Welcome back, everybody. You know, in a constantly changing fertility landscape, our next guests are committed to supporting their patients. Audubon Fertility is a full-service clinic and embryology lab, and today we are learning more about the services they offer. Joining me now are Dr. Lindsay Wells and Dr. Nicole Ulrich. They are board-certified reproductive endocrinologists. Welcome, ladies. Thank you so much for being here.
Thank you for having us.
Yes, and this orange ribbon right here, what is this?
Yes, so this I got when I was in Washington, D.C. a few weeks ago, supporting one of the federal bills for IVF protection. And so this is just saying, you know, we want fertility access for all.
I love it. I just wanted to ask you that because I think it's so cute. Let's talk about that.
Yes.
You all are advocates, which I think is great. And as many people may know, the topic of IVF has been in the news a lot lately. Okay, Dr. Ulrich, please remind everybody what happened in Alabama.
Yes, so there's been a lot going on in our world legally lately. So in Alabama a few years ago, there was an incident where an unauthorized person accessed embryos that were frozen.
Wow.
Yes, and accidentally destroyed several of those embryos. And you know, it was obviously a tragic event, unanticipated, and very unusual. But the families who own those embryos then brought legal action, which ultimately resulted in the Supreme Court in Alabama taking a stance that those embryos were actually children as opposed to frozen embryos. So that, you know, the result of that was that IVF and fertility treatments surrounding IVF came to a halt essentially in Alabama.
And it was unbelievable. I will never forget when it broke, because for a lot of people who may be going through IVF, a lot of times it doesn't work the first time, you know.
Exactly.
It takes a little bit of time, and to think that, oh, these are children and all that, it's unbelievable. And you know, we're seeing some things happen in Louisiana as well in regards to IVF. What can you tell us?
Right, so Louisiana is a little bit unique. It's the only state in the country that has a sort of special elevated status of embryos, at least until what happened in Alabama came to pass. But here, we consider embryos to be juridical persons, which gives them sort of a special status relative
What does that mean?
So that means that embryos here they're not considered natural persons, but they do have the ability to sue or be sued, and also they cannot be destroyed here, which is a component of normal fertility care in other states. So because of that, it does create some inconsistencies in the law. And so as of right now, IVF and fertility treatment is still somewhat vulnerable to legal action, similar to what happened in Alabama. Now, to be clear, there's nothing going on like that right now. There's no immediate threat, but because of the inconsistencies in the law, it does sort of open us up to that possibility.
And I appreciate you all coming on the show today to really educate us all, because if we're not in need of this service, sometimes we bypass. But as somebody who watches the news all the time, I was very aware of what happened in Alabama and in Louisiana as well. And I appreciate you all, Dr. Wells at Audubon Fertility, because you all are really trying to be advocates as well. You all focus on fertility. Talk to me about the services you all offer.
Yeah, so we're a comprehensive fertility clinic. We basically offer all the fertility services to help patients or couples conceive. We do thorough testing, fertility assessments, which can include labs and ultrasounds, semen analyses, other types of imaging. And then we offer a variety of treatments as well. So that would include things like ovulation induction, IUI, IVF. We also see a lot of patients in the LGBTQ community as well.
Because they're trying to conceive in a different way, I'm guessing, than the natural way, right?
Exactly, yeah.
Fascinating.
So we do a lot of third-party reproduction with donor sperm, donor eggs, donor embryos. And then we see a lot of patients for fertility preservation. So a lot of patients now, a lot of women are freezing their eggs.
Yeah.
And so that's becoming quite popular as well.
And you know, a lot of people may look online, Google IVF, and they see big needle, very scary, but it's not necessarily that. For people who are wondering, you have a little model here. What does that IVF process look like?
Yeah, so it's about a 2-month-long process. The first month is focused on the stimulation of the ovaries. So patients are giving themselves small needle subcuticular injections in their belly for about 10 days while we monitor them with ultrasound and labs. And then at the end of that 10-day period, we do an egg retrieval, which is a procedure under anesthesia, where a little needle goes transvaginally into each of the ovaries so that we can retrieve the eggs. Once the eggs are retrieved, they go to our IVF lab where embryologists can identify them under the microscope. And then that day they are inseminated by either the partner sperm or donor sperm. And then the embryos that result are cultured out in a lab for 5 days. And there's a big drop-off. So some of the eggs that we retrieve don't fertilize. We typically see about 80 to 90% of the eggs fertilize.
Wow.
Some of the embryos don't make it to day 5. So we see typically about 50 to 60% of the embryos make it to that blastocyst stage at day 5.
And it can be a long process, but hopefully it's an effective process because it will end in what? Pregnancy. And you know, again, we're seeing some changes here in Louisiana. Dr. Ulrich, is there anything that we can do to help? I know you've been rallying at the Capitol and all of that. How can we make sure what happened in Alabama doesn't happen here in Louisiana?
Right, yeah, that's a great question. I mean, so we at Audubon, myself, Dr. Wells, some of the other people there have been working with state representatives and legal experts in Louisiana to kind of help bring some legislation in our state to help protect IVF. So we're working on that. But we definitely need support of the community, and we're trying through online, like social media accounts and you know, other types of publications to educate the community on why we're doing what we do, what impact will it have if we don't do what we're trying to accomplish legally, and then also tell them how to help, because it is an incredibly confusing process, the legal system here and federally, as I'm coming to find out with all this advocacy work.
But you're doing what you can, and I appreciate both of you all coming on to educate us. And look, if you feel like you're a candidate for IVF, get in early. That's one of the biggest tips. You never know until you know. The name of the company, Audubon Fertility. It's located at 4321 Magnolia Street, right here in New Orleans. For more information about their services, audubonfertility.com. All right, stick with us, everybody. We'll be right back.